the persistent effects of inadequate iodine during pregnancy. But of course, as we all know, observational studies are often confounded by other factors that affect child development. And it's difficult to draw certain conclusions from these studies. There are prospective studies which suggest that early maternal hypothyroxanemia has been linked to poor infant development. The studies by Popp in Dutch women with a free T4 less than the 10th percentile in the first trimester showed delayed neurodevelopment. But this population was done in a presumed iodine-sufficient Dutch population, so that the hypothyroxanemia was not due to iodine deficiency. There's also a study published in Thyroid in 2009 in mildly iodine-deficient Spanish women with early hypothyroxanemia. This is, again, a free T4 less than 10% of the percentile for the population. And these infants, despite iodine supplementation and a normal FT4 at term, had a lower developmental quotient compared to control infants. But the problem with this study was it was a very small sample, only 10 to 15 infants were compared between groups, and it looked like mild iodine deficiency persisted despite supplementation. What was interesting in this study was that 33% of women had a free T4 less than the 10th percentile, and free T4 was actually clearly abnormally low in 8%. So what about intervention trials? Are iodine supplements in pregnancy in regions of mild to moderate iodine deficiency beneficial? We've actually had 6 randomized controlled trials in Europe involving 467 mild to moderately iodine deficient pregnant women. These have been done in Denmark, in Belgium, in Italy, in Germany. I'll show you just one of them, an early one done by Peterson and Peter Lorberg's group in Denmark. This was a randomized controlled study of 200 micrograms of iodine per day from 17 to 37 weeks gestation. And what they found was there was an increase in the median UI in the supplemented group up to about 90 to 110 micrograms per liter. This, of course, is not up to 150 micrograms per liter, which is the current recommendation for iodine sufficiency in pregnancy. But what they found was, you can see in the lower 2 figures here, that there was a lower maternal TG in the iodine supplemented groups and a lower maternal TSH in the supplemented groups. But what they found was no significant differences in maternal T4, T3, or free T4, and no differences in core TSH or thyroid hormones. There was less of a decrease in thyroid volume in the iodine supplemented women, and there was a lower core TG in the treated versus the control infants. But this pattern has been generally consistent throughout these 6 trials, and if we were to summarize these 6 trials together, what we can say in summary is that the dose, there's no predictable dose response in these studies. Doses range between 100 and 250 micrograms per day. It looks like doses that are at least 150 micrograms per day may be more efficacious based on the change in maternal UI and thyroid volume. These supplements appear to be safe in these studies. There's no aggravation in the mother of thyroid autoimmunity or postpartum thyroid dysfunction by iodine supplements. And one of the studies was done specifically in TPO antibody positive women and showed no aggravation of thyroid autoimmunity in the postpartum. In infants, it appears these supplements are safe. There's no increase in TSH in most of the studies. But in terms of efficacy, I think the data are persuasive in both the mother and infant that there's reduced thyroid volume and TG values with iodine supplementation. But what's been quite consistent throughout all studies is that data are quite equivocal when it comes to looking at thyroid hormones. Only 2 of the 6 studies reported maternal TSH was lower. This was within the normal reference range with supplementation. And none of the 6 studies showed a clear improvement in maternal free T4 levels or other maternal or newborn thyroid hormones. So I think these data are generally reassuring in that they suggest that mild iodine deficiency has a little effect on circulating maternal or newborn thyroid hormone concentrations. If we believe that free T4 in the mother or the thyroid hormone profile in general is the best surrogate biochemical measure we have for healthy fetal development, these are important findings. These findings suggest that in areas of mild iodine deficiency, the maternal thyroid is probably able to adapt to the increased requirements during pregnancy by a slight increase in TSH